Welcome to another webinar on mental health and COVID-19. This is the 9th webinar. My name is Niall Boyce. I'm the editor of The Lancet Psychiatry, and these webinars are a joint project between ourselves, MHPSS, the Mental Health Innovation Network, United Global Mental Health, and we've also been very, very grateful for the support of WHO through this whole project. Today, we are going to be talking about the mental health of children, youth, and carers. Now, before we get going and I introduce our panel, I'll just give a few notices. This session is being recorded, so if you miss anything, don't worry, you can come back and watch the recording later. We're also going to put a transcript online. We're tweeting using the hashtag COVID19MH. And once we've finished talking, this is going to take about 45 minutes. Once we've finished that, we'll be continuing a bit of a chat online for about 15 minutes. So use that hashtag and we can continue the discussion. So without any further ado, I'd like to introduce our panelists. We're joined from New York by Zeinab Hijazi from UNICEF, from Chile, from the Ministry of Health there by Matias Irarrazabal. We're also very pleased to be joined from WHO by Chiara Servilli. We also, and I'm delighted with this, we have the Voice of Youth, which is a label which has not applied to me since some point in the last century. But we have the Voice of Youth here today in the form of Josiah Tualamali'i from New Zealand and also Aimee Wade. Now, I'm not going to say a great deal more. I'm just going to go straight into the questions. And the first person I'd like to talk to is Aimee. Now, Aimee, the first thing I really want to know is what are the mental health needs of young people from your perspective? What are young people themselves saying about what they need during this crisis and beyond?
Okay, first of all, thank you, Niall. So I'd say that right now in this lockdown where a lot of young people are quarantined and practicing social distance, countries like Belize and a lot of other places, I'm pretty sure a lot of people watching could relate to this. We don't have enough professional resources and support. So I'd say what young people need is support, one, support that how they're feeling is okay and how they're feeling in this lockdown. A lot of us haven't experienced this before. It's new, so it's okay to have these emotions. The resources, professional resources. Belize doesn't have a lot of resources, and I know a lot of countries don't have a lot of resources for mental health. And yeah, I'd say resources and professional support.
Okay, so when you say resources and professional support, does that mean people you can see one-to-one or talk one-to-one with over systems like Skype or Zoom, or does that mean maybe other forms of resources, say apps or novel forms of digital support? What kinds of things do you think are needed? Do we need to innovate with what we mean by resources, perhaps?
I would say like one-to-one chat, or even maybe like a group discussion, how they're feeling. You know, people, I've seen it a lot whenever they're in a call and someone starts expressing how they feel, then another person feels more comfortable speaking about how they feel instead of they just talk about themselves and then they feel okay, well, I'm a burden because I'm just talking about my problem. So I think resources with calls one-to-one and also in a group.
So it's really about sharing experiences and support. That seems to be the most basic level of what you're talking about.
Yeah, I'd say so.
Yeah, and I'd like to move across then to Chiara. To what extent does what Aimee says chime with you from WHO's point of view? Is this the kind of thing which you've heard? Is this the kind of thing which you're encouraging resources to be put into? You've muted your microphone, so you'll just have to unmute it, I'm afraid.
Yeah. Yes, I would say, that in the context of the COVID-19 pandemic, youth, across different countries and regions have been reporting a deterioration in their experience of mental health and psychosocial well-being. But, as Aimee was saying, the experience can be very different according to the exposure to different adversities and different situations that make particular adolescents in certain communities or in certain groups even more vulnerable to experience poor mental health and even develop mental health conditions. So I'm referring, for instance, to those adolescents, to those like 42 to 66 million, so estimated young people that may fall into extreme poverty as a consequence of the current situation in the next 1 year. And I'm referring to those that may experience violence or stress in the families, and that, as Aimee was saying, are less supported across different contexts. They may have less support in their families. They may actually experience stress in the families. They may have less access to education and hence also to resources in schools. As we see, education sector and schools as an opportunity for adolescents to experience social support, peer support, but also role modeling and access to mental health promotion, prevention services. And for those adolescents, they may require, additional resources, additional investment in youth mental health. And we know already that, if there is one thing that is common across different settings, is the stigma that hampers access to services and the common experience of young people that report being unhappy with their possibility of accessing care wherever, they feel they may, benefit from support from mental health services, be it in primary health care, in community setting, or in the context of schools. And we are, actually concerned.
So
yeah.
I was going to say, so it sounds as if what we have some sort of common experiences and common problems, the sort of uncertainty, the lack of access to services that Aimee was talking about. But then, it's impossible to generalize in a way because there are very specific groups, and what's needed there is maybe additional and more novel forms of proactive outreach and support.
Absolutely.
And as for what help's available, what kind of help can be accessed by young people at the moment who are maybe experiencing problems with their bereavement because of the virus, facing an uncertain future in terms of education and training? What resources are available? Is enough available and it's just a matter of connecting people, or do we need to really build new systems and innovative systems?
We have been seeing, over the past few months, even a surge in innovations in terms of, exploring potential of doing things differently, exploiting, for instance, technology as a way to reach out adolescents that might have been, in confinement, but definitely, the resources and investment in the services that are accessible to adolescents are not enough. And we need to exploit, this increased awareness of the mental health needs of adolescents as an opportunity for transforming services and for, strengthening care systems across different platforms to promote mental health, prevent mental illness and provide care to those that experience mental health conditions.
So I'd like to turn to Zeinab. Now, Zeinab, whenever I think of child mental health, adolescent mental health, I'm always reminded of the thing that Donald Winnicott said about there being no such thing as an infant or no such thing as a baby, because when you think about a child, you then immediately think about the carers. You think about the immediate social setting of the child. And I'm interested really in the way in which this pandemic and lockdown and everything that's attended it might have affected the relationship between parents, between carers and their children. What has changed?
Thanks, Niall. Such an important question. And, just building on what Aimee and Chiara were saying, for children and adolescents, the mental health and psychosocial impact of restricted movement, closed schools, and isolation, they are likely to have intensified already high levels of stress, especially for vulnerable and at-risk children and adolescents. But at the same time, parents are under increased levels of stress due to worries about the virus, this overwhelming sense of hypervigilance related to protecting their children and themselves from infection, lack of access to social supports, needing to care for sick or older family members, managing the increased pressure of balancing work and homeschooling, and increased financial difficulty. The layering of these multiple stressors on caregivers can really lead to tension within families and between parents and children. But not to just paint a dire picture, you know, even though children and families may be experiencing these increased levels of stress, there are also opportunities to strengthen family dynamics through activities that help to restore protective relationships between carers and children. And there are a lot.
But can you deliver those activities if clinics aren't open? Are there ways you can remotely provide this sort of guidance, this sort of therapy?
So certainly, I mean, the COVID has, you know, really led to restriction in movement, as you know. What we have tried to do is really support, you know, communities, support frontline workers with key guidance and resources that enable them to ensure the continuity of these essential services to caregivers, to families, particularly when we talk about, you know, child protection services and, you know, frontline workers who really need to continue specific services to vulnerable children. There are guidance around that. It's not to say that the guidance is perfect. I think there are some largely unaddressed issues as well in direct relation of how to support parents. So for example, two things that remain largely unaddressed are how to support caregivers who have children at home with developmental and behavioral disorders, for example, such as autism. There are a lot of general parenting messages that are being created and disseminated, but few with psychological messages on and concrete guidance for caregivers for children with developmental problems.
Right, so this relates to something which I think has come up before, which is that there are existing inequities in service provision and service delivery, and that these have been perpetuated in the current situation. In fact, maybe they've been made worse.
Oh, absolutely. I think one, you know, oh, can you hear me? Hello?
Yes, I can hear you.
Yes, sorry.
Yep, I can hear you.
Absolutely. I think,
Okay.
you know, one of the things that we've seen as well is that there are a lot of self-care and self-help tips and guidance targeting parents. But what about carers with pre-existing mental health conditions? A statistic that we hear over and over again is that half of all mental illness begins by the age of 14. And this is a reflection of a stark reality. And I find that a statistic that is far less mentioned, but equally, if not more stark, is that 1 in 4 children is living with a parent who has a mental disorder. And this is pre-COVID. So this remains true during COVID, if not worse. We know that there are linkages between mental health and child development, and that where parents struggle with their mental health, they will often struggle to provide the kind of responsive care that we know is needed. So it's really impossible, especially during COVID, to separate child and parental mental health since one shapes the other.
Thanks, Zeinab. Now, I'd like to turn to Matias, because a lot of the discourse around mental health in general, and specifically young people's mental health, has really been based around rights, around the right to access care. And Matias, I'd like to hear a bit from your point of view on this topic which Aimee raised initially, which is how COVID-19 has affected access to care for young people. And I'd like to know about what the solutions might be from your point of view. Okay, I'm not sure if we have Matias. I know he had a bit of trouble connecting earlier. Okay, Matias.
Do you hear me now?
Yeah, I can hear you now. There's a bit of noise, but I can hear you. So go ahead. Did you hear the question, Matias?
Yes, thank you.
Grant. Okay, go ahead.
Let me try to fix this. Well, as the presenters mentioned, I think that it's important to know that young people who belong to groups that are already marginalized or disadvantaged may be particularly at risk in terms of not getting enough services. many vulnerable young people, such as young migrants, young refugees, homeless young people, those in detention, and young people living in crowded areas, such as townships, for example, slums, here in Latin America are quite common. And they live in conditions that put them at greater risk of contracting COVID-19, but at the same time to have less services than the rest of the population. They also have limited access to technology, so many of the solutions that has been preparing the governments are based on technology, but we know that there is a huge inequality in terms of access to technology and communication, and other forms of education and information. Many of the schools have closed in Latin America and many other regions in the world, and they are basing the education and in homeschooling or teleeducation, which for many of youth has been very difficult to get because they don't have access to internet. So while mental health professionals, we all think that they deserve enormous credit for responding to the challenges that the pandemic brings, many young people who were receiving some form of mental health treatment before the crisis, now they are receiving reduced support or no support at all. And many young people who will not previously have met the threshold for mental health support are very likely to require it. And so I think that the needs of the youth and children population have increased, but the access to the services have decreased. And so we have a very difficult time, and we need to improve prevention and preventive action, and to try to improve the access and lower the gap, the treatment gap for most of the youth. With the restrictions to the access to schools, we had many preventive actions in the schools, and the universities and primary care. There is uncertainty about how and when to access mental health support. So we need to communicate to the youth to try to improve the communication with them and try to see other ways to improve the treatment and the prevention of mental disorders. We know that many young people have also lost the coping mechanism that could help them to manage their mental health. So it's important also to try to improve the communication in terms of to improve the education about mental health and how the coping mechanism can improve the symptoms right now. When is it safe for restriction to change? There needs to be a clear plan about how to grow and develop services. And that's the main stage that we're having in Latin America. We need to enable social reintegration and how to support groups who are affected by the crisis. Neil, thank you.
It just strikes me, Matias, that thing you say about communication, because a lot of the innovations in mental health care for young people and for adolescents, which I've seen over the past 5 to 10 years, has been based around the institutions they attend. So it's been based around school-based programs, or for young people, it's been based around universities. We've certainly seen in various countries a huge increase in campus mental health services. Now, if young people are accessing their education in a different way, if they're being homeschooled or if they're receiving education online, what happens to that kind of support? How can that support be delivered?
Neil, that was a question for me?
Yes.
Sorry, I didn't get the whole question. Can you repeat it, please?
That essentially, if young people aren't able to attend school, or if they're not able to attend university, and if what they're doing is getting their education online, what happens to the kind of mental health interventions and mental health support that used to go with attending those institutions? How can it be provided instead?
Well, that's a very good question, because additionally, with the closure of schools, continue to impact the education of adolescents and youth, and it's also fracturing the social networks. We usually use the network, the youth network, to improve mental health, because that's the main network that they have. most of the youth doesn't have a very good relationship, if I can put it in those terms, with the family. But many times they use the peers, their network, to try to improve their mental health, to try to improve protective factors that can increase resilience, for example. But yes, we have had these disruptions to formal and informal ways of communicating with adolescents and youth, new pressures on livelihoods, including violence, for example. And in that way, I think it's important to try to build some programs that aims to educate the youth population at home. So we have to use social network. We have to use internet, TV, in some regions, radio stations, but that are mainly run by youth. And so that they're not run by adults. They're not built by adults. They should be built or designed by youth in a way that we can communicate in an effective way, and at the same time to try to improve the education in terms of prevention for mental disorders and try to decrease substance use. There has been many good initiatives from the youth population. For example, there's a platform called the COVID-19 Youth Platform, based at the United Nations Major Group for Children and Youth and the Children and Youth International. It's a platform where the youth groups can give visibility to youth initiatives responding to COVID-19 and to health, social, and economic consequences of the pandemic. So this is a platform where they can use the information from other groups. For example, in Latin America, in Chile, we have one group called the Digital Creators, which is an initiative to reward creativity in the midst of the coronavirus crisis. They look around, they imagine what they can do to improve the environment, what they can do to make the quarantine more supportive, how they can help the neighbors or family without exposing them to the virus. And they have expanded this group in terms of action. It's been very effective in that group. In Peru, for example, Youth at Home, Jóvenes en Casa, use digital tools to reduce mental health problems and to connect young people in the context of the epidemic and the state of emergency that is in Peru. So I think that we are more restricted in terms of trying to communicate and access the youth population, but there are still many ways that we can improve education about mental health, do some prevention, and try to improve the willingness of the youth population to access to e-mental health services.
Thank you, Matias. Now, with that in mind, I'd like to turn to Josiah. Now, Josiah, you are in New Zealand, where it is very early in the morning or very late at night. And well, yeah, to people, for instance, in the UK, where I am, New Zealand has seemed like a big success story in terms of the control of COVID-19. It's being touted as a success story. But I wonder if this reflects the experience of young people in New Zealand.
Oh, tēnā koe, Niall, and talofa lava, everyone listening. Interesting question. I mean, we have been so fortunate in our geographic distance, the leaders that we have who have acted early. We were one of the first countries to close our borders on the 28th of February, and that was a very controversial decision around the world. But our chief doctor is basically now a superhero in New Zealand, and so we're very lucky for those people being in their roles. But I think it's a bit more than luck. But to get on to how young people are going, there's been a real split. A young woman, a young high school student in our main city, Angalefili Felipuai Tupuai, she's wrote this beautiful speech last week that she gave, And this is one of her quotes, and she said, our Decile 2 school opened today, spent it watching people swap leavers notices for CVs because money and low and mouth's got to feed. And basically, in this bigger speech that she wrote, she talked about how a number of young people were trying to decide whether to even go back to school. They've taken up jobs during the lockdown to support their families, and because of the situation, even though New Zealand is far away from some of the most significant effects, like we've already been talking about, inequality has only got bigger. And so for Anga Ngaliafili and her friends, that's the reality they're in.
Okay, and so that split that you described, Josiah, I mean, I'm very interested in the experience of minority youth as well. Do you think that there have been specific challenges faced by minority youth in New Zealand and maybe globally in the face of this pandemic?
Most definitely. One of the challenges that I hear minority young people talking about now and also in the midst of other crises has been worrying about their parents. So not being able to go back to school or work or the other everyday life activities and be a young person, be a child, because they now have that weight on them. A sense of some of the innocence that they might have had is gone, and that's one of those differences now.
Yeah, because I think that's the thing which always strikes me about child and adolescent mental health. I'm sorry, there's a bit of an echo on the line, but I think we're just going to have to cope with it. Is that okay? One of the things which strikes me with child and adolescent mental health is that what in the adult world we'd think of as comparatively short periods of time, say 3 months, 4 months. What you're describing there, Josiah, are ways in which these periods can really have big changes in shifting someone's direction in life. Would you say that that's the case?
Most definitely. Some of the things that our parents and our grandparents and those who tell us stories, you know, they talk about when I was a child or when I was young, and this is probably one of those moments for our generation. And so it's trying to be careful about, like, are we really making the tough choices in the way that brings the best outcome for all of the communities, not just some, and not just prioritizing those who have political agency and those who do vote and those who are protesting. I think with the Black Lives Matters situation that we're seeing at the same time as this, we know whose voices are not normally well listened to, and that's what we have to take even more effort, more care, and more love. And we have to be able to be comfortable with using the language of love in this around those forces and people.
Yeah, and this is a question really for the whole panel, which is at the moment things are in transition. I think when lockdown was happening, we had a lot of think pieces about the sort of world we'd like to see when lockdown eased. Well, lockdown's easing. COVID-19 isn't over, but the situation is certainly changing. I wonder about the future challenges which young people face and what can be done about those. So I'd just like to return to Aimee, and maybe you could start off by saying, as the situation evolves, what sort of problems do you see emerging now and what might the solutions be?
I'd say what are the problems and solutions?
Yeah, that are sort of emerging in the future.
Well, for young people and adults here around, it would be economic issues, having to go back. You know, we're not only going through all of this time and lockdown, there's a lot of jobs that were lost. So I would say economic issues and young people having to go back to school and not being able to pay their fees, or parents, caregivers having to have food on the table. So I'd say the economic issue would be one big thing. looking into the future, how we would come out of this.
Yeah, and this is something I think, you know, that certainly we've heard that young people, the sort of employment prospects which young people face, which were pretty difficult already, have just been made much more difficult by this pandemic. Chiara, does that reflect the reality, that statement?
Yes, I agree with Aimee. The challenge of the young people currently is really facing the uncertainty around what is the current impact of COVID pandemic on their lives, on their families, on their family lives, on their life perspectives, and you know, their life trajectories. You know, they may be preoccupied by the changes that COVID pandemic have already caused in their current situation. You know, as you know, it has been said already, you know, some of those young people may not be able even to go back to school. You know, they may have lost jobs, they may have experienced impoverishment. But also, I think, you know, we need to recognize that adolescents and young people have also, you know, already stepped up in terms of taking an active role in the context of this pandemic, and have raised their voice even more than before to have their mental health needs, you know, voiced out. And I think, you know, I would like to highlight as one of the big challenges for them, but also maybe a priority and an opportunity, you know, the fact that they will have an increasing role in terms of, you know, advocating for increased investment by governments, for governments to really, you know, be accountable to young people on the way they respond and they invest in mental health care systems and opportunities to promote and to support their mental health. And also, maybe, you know, the young adolescents have been really astonished, you know, by the capacity of young people to react quickly and to be available to support even more societies and families and peers that, you know, were struggling with the immediate consequences of the confinement and the other, you know, consequences of a COVID pandemic. So they have been really active in the current context. I believe, you know, they will need to maybe capitalize on their experience and their active role in this pandemic and promote, you know, more cohesive societies and environments that really promote mental health for them and for everybody else.
Right, so there's one thing you said there which I'd just like to take up with Matias, actually, assuming that Matias, you're still on the line, which is that government should be held accountable to young people in terms of mental health provision. Now, this is a great aim for the future, but young people don't have the vote. So how exactly can governments be held accountable to young people, Matias?
Sorry.
Go on, Matias. Yeah.
Yes. Thank you. That's a very good question, Neil. And I think that and a complex question also, but the governments need to prioritize mental health. So the first action that we should do is to try to improve the agenda about mental health. We should provide mental health support and guidance not only for youth but also for families, for carers, for children and the youth population. It's important to be quick to adapt to the changing landscape. I think one of the criticism of the youth population is that we're always very slow in terms of action. We need something right now, and they are right about that. We need to move support online, to use innovative approaches to save service delivery. So much of the youth population doesn't want to go again to the consultorio, to the medical clinic. They want to try, for example, mental health, and try to reduce the gaps in infrastructure, in funding, which threatens the long-term sustainability of the efforts. That's why the government should take a clear and coordinated approach to tackle the impact of the pandemic on children and youth, launching a recovery plan which can enable the growth and continuity of support. And that can include, for example, immediate emergency funding to increase youth, people, and family access to mental health support through youth organizations. We should include the youth organization in the design of the response about COVID-19 to ensure that clear routes are available for youth to access mental health services. While restrictions are still in place, in Latin America, we still have many restrictions in terms of quarantine and lockdown. To launch a national campaign to promote positive approaches for maintaining mental well-being. This is an emergency that's going to last a lot of months. It's not an earthquake. For example, here in Chile, we are quite used to earthquakes, but this is not an earthquake. It's an emergency that is going to continue for many months. So we need to also to commit to introduce additional support for youth mental health as we move out of the pandemic to meet the rising demand that is going to be in mental health, to launch a cross-government strategy for young mental health, and to include the youth in the design and the implementation of the action.
Okay.
So we recognize
Matias, I'm just going to have to stop you there because we are, we are very short on time at the moment, and I'd just like to pick up on something that you've said and put the question to Zeinab, which is that you talked about this as being an emergency, and you talked about how governments have experience of dealing with other acute emergencies. Now, of course, in some settings, this pandemic is a crisis on top of a pre-existing crisis. And one of the questions which I've had over the email from one of the people watching is, what do we do in the areas where there is, say, armed conflict and the pandemic on top of that? How do we improve the mental health of children and young people in those situations? So I wonder if, from the UNICEF perspective, Zeinab, you have anything which you can add on that?
Thanks, Niall. Such an important question, and I think we struggled with this quite a bit during our response to COVID. I think a lot of the things that we were putting out, really relied heavily on the digital world, the digital platforms, in continuity of services through telecommunication and things like that. It really didn't speak to humanitarian settings, especially with settings where there are low resources and low capacities with pre-existing issues, that were already unaddressed effectively. So I think for us, continuing to prioritize humanitarian settings is key, both now during the COVID response, but also as we transition to some form of normalcy. We talk, I hear Matias very loud and clear, and I think as I listen to him, I think about this this really difficult endeavor, I think, to help us transition to some form of normalcy, and that we really do need a coalition of committed educators, mental health professionals, policymakers, and families to help us confront this issue collectively. Now, for humanitarian settings, this is increasingly difficult because the mental health infrastructure is often not there, not functioning. So we really need to be working to help build some of that infrastructure. Think about the needs of children and youth. I think a lot about the challenge of transitioning back to school. We talked a lot about schools and return to normalcy. In humanitarian settings, education is such an important component of children's protection. And we even Chiara said something really nice, which is that schools are in a unique position to work with parents and to engage and support children with compassion. And I feel that what we need to be working towards is a managed process to different things, to school return in humanitarian settings and non-humanitarian settings, really kind of thinking about what that process means. How do we support children who might need additional help and maybe struggling with emotions or their learning? How do we create learning environments for children who are in school or children who are not in school, but maintaining that learning environment and the one that really prepares and encourages children to welcome with sensitivity and empathy a peer that may be struggling emotionally or with learning. So again, it's not just the responsibility of the teacher or the parent, but how can we work with adolescents for them to be that support that their peers need. And then of course, knowing when to refer children, who might need more focused care and support from a mental health professional. So really, these systems need to be in place across settings, but perhaps more so in humanitarian settings where, access to services is not always easy or available.
Thank you. Now I've got a question here which has come in, and I think that Josiah is the person to answer this. This is from Nick, who is from Euro Youth Mental Health. He says he joined a bit late. Don't worry, Nick, that's okay. Good to have you here now. And he's curious to hear as to what involvement young people themselves have had in collaborating with professionals in the mental health response to the support which they need. Now, Josiah, I know that this is something which you've been involved with. Are there any specific projects at the moment relating to COVID-19 and mental health support which you're involved in or which you know of?
I think there's a couple of different levels, and so it's so nice to hear, that there are other young people watching this. So much love to all of you out there who are watching this now or later. But obviously some of us have just gone and kept in touch with our neighbours or the friends in our communities, or maybe those at our school or in our learning environment or work environment. That's been one of the ways. Other ways of like the small pockets that have popped up, Facebook groups, house party activities, escape rooms online, all of the different informal ways that we have helped maintain our well-being. And I think it's very important that we do acknowledge those things as part of the response, because it's very easy for us to acknowledge what government and what leaders have done, but actually a lot of what community has done and big community has done has been making the maintaining our well-being. Obviously, we've also seen the UNICEF have a group of young people called Leading Minds who help feed in insights on what's happening in different countries to them so that they can respond at a regional level and also collaborate with governments so that young people's voices get into those decision-making spaces. I've also seen organisations like the wonderful one that's hosting the conversation alongside you now, Niall, United for Global Mental Health. Your youth advocates have been plugging in. And I think one of the important ways that we've seen young people have massive value in this time has been in convening the voice, and that's to try and notice the gap. So often, and we've heard it from WHO really well, that in big crises like this, we don't necessarily always have the time to consider all the different options. We have to sometimes have moved quickly and make choices based on what we know in that moment. And young people have actively ensured that the different things that should be considered continue to be. And there's a resource thing that will help keep that going, but that's been one of those ways.
Thank you very much. Now, we're almost out of time. So there's one last question, which I'm going to put to all of the panel, and I'd like really, really short answers, if possible. And by short, I mean as if I was cycling past you, and this was the one thing you had time to say to me. So my question is, what do young people need right now? And I'd like to start with Aimee.
I would say reassurance. That's my answer, reassurance. Reassurance that we will get out of this, and we'll be great, and we'll come out of this fine. So reassurance.
Okay, thank you. Chiara. You need to unmute, sorry.
I would say they need governments that place mental health and children, families, and adolescents at the center of the response to COVID-19, with a due attention to equity and access to promotive, preventive, and care interventions, but equity also, really looking at the most vulnerable segment of the population.
Thank you. Zeinab.
I would say children and young people need us to support and nurture their capacities and leadership in their communities and countries. Simply, if we want change, they are our agents.
Thank you. So Matias, in one line, what do young people need right now?
I think they need to participate, to be included in the public health actions. That's very important, because otherwise the implementation is not going to work.
Okay, thank you. So the last word goes to Josiah.
Hope, hope, and more hope, and to read Angafili's speech.
Thank you very much. Okay, so thank you very much to all of our panel. Thanks to you for joining us. Now, as I mentioned at the start of this session, the discussion continues on Twitter using the hashtag COVID-19MH. So our panelists, Lancet Psychiatry, will be around looking at your tweets, answering any questions for the next 15 minutes or so. The next session in this webinar series is going to be on June the 9th, and this will be on mental health and human rights in the time of COVID-19. You can go to the unitedgmh.org website, you can register there, you can submit questions in advance, and you can read notes and listen and watch the recordings of all of the sessions so far. So I hope you'll do that. Thank you very much again for joining us today, and I hope you'll join us again next time. But for now, goodbye.